Welcome to Malpractice Podcast.
Hey, are you ready to get started?
Yep, I'm ready.
Welcome back to the world of the living, kind of.
Yeah, we are alive.
Jess has been sick for the last week.
Yeah, I'm here. I'm like on the mend.
You sound better than you did maybe 2 days ago. You sounded like you were
I was really
deceased.
sick. Yeah, I was really sick.
Mm-hmm.
Something that the doctor was telling me, just to share with our listeners, is there's like a lot of stuff going around.
Yeah.
Obviously. And I think what's compounding everything is, like, of course, people haven't been outside, right, in a couple years.
Mm-hmm.
But now our immune systems are like figuring out how to fight things. And if anyone has like laxed off the extreme hand washing or like all of the hand sanitizer you were using, expect some sort of like flu-like thing in this time of the year.
No.
Unless you like stay super vigilant.
Yeah.
I mean, COVID is still there, but it's also like the flu and like strep.
Yeah.
Getting a cold can knock you on your ass.
Yeah, 100%. You're not the only one in my life who is sick right now. I know a lot of people who are dealing with this, so it's good to know that doctors are, I don't know, telling people to be more careful.
And you spent the weekend doing some fun stuff.
I did. Happy Mother's Day to all of our listeners. Although I guess by the time we release this, it's like 4 days after Mother's Day.
Happy belated, y'all.
Happy belated Mother's Day.
To you.
I went on a Mother's Day retreat that my mom planned this weekend for her sisters and nieces. It was really nice.
It looks so fun.
Yeah.
Spoiler alert, Sydney has 1,000 aunts.
I do.
And uncles. And so it's like they're all fun. Like, it's all a party when they're together. And it was,
Correct.
I was looking at the pictures, definitely jelly. Would have given everyone whatever I had to be there.
You definitely would have. My my mom's maiden name is Green, and we found these bottles of something that tastes like
Ooh.
green apple Jolly Rancher.
Oh.
And it's called Kinky Green.
So there's that.
So that is what we took shots of all weekend, and that's my family.
That's fun.
That's really all you need to know about my family to know pretty much everything about them.
100%.
Yeah.
That's very descriptive of them.
Yeah.
That sounds so fun. I just sent my mom flowers and was like,
Peace.
got a blast.
Peace from a distance.
Oh my God, wait.
What?
Does everyone know I'm obsessed with jury duty?
Oh, yeah, they do.
I got a summons.
Jessica got a jury duty summons.
I'm so excited.
It's the highlight, the crowning achievement of your entire life.
I'm so excited to go. First of all, I want to be on any case.
Yes.
I'm down.
Right.
I'm not going to say much more because if shit goes cray and I do end up, then they could use everything I say against me. God damn it, there's probably so much evidence against me in this podcast.
There's a lot. It's all recorded. It's all available on the internet.
Well, I'm so excited. I'm so excited.
They Google juror number 6 and they find out you have a medical malpractice podcast and you're on a medical malpractice case.
A dream.
They're like, dismissed.
They would dismiss me.
They would probably.
They'd put me on some traffic case. I'd be just as excited. Don't get me wrong.
You love jury duty.
Be in a jury box? Bitch, me? With my notes?
They're going to make you the 4-person, I can already tell.
I want to be so bad. I want to do it so bad.
They're going to be like, she's a crazy person. Do not let her.
I'm going to be too eager. They're going to be like, something's wrong
big
with
eyes.
her.
She's giving the attorney big eyes.
Please pick me, yeah.
You'll have to keep us updated about jury. Well, you can't.
I'm so excited.
Okay, you want to get into her intro?
Yeah.
Okay.
Today we're going to speak with Lauren Brinkley-Rubinstein, doctor. She's a assistant professor of social medicine at the UNC School of Medicine and an adjunct assistant professor in the Department of Health Behavior. She's also a core faculty member in the UNC Center for Health Equity Research. She received her PhD in Community Research and Action at Vanderbilt University and completed a postdoctoral fellowship at the Brown University Warren Albert Medical School. Whew, that is like
That's a mouthful.
all of the things are a mouthful.
Some of Dr. Lauren's research focuses on how incarceration can impact health outcomes. 40% of all incarcerated people in the U.S. currently have a chronic disease, and many find out that they have a chronic disease for the first time because they were arrested. According to Dr. Lauren, that's an indictment of the lack of healthcare access in this country. She's pretty incredible, and we're super excited to speak with her today. So welcome, Dr. Lauren Brinkley-Rubinstein.
Hi, I'm Lauren Brinkley-Rubinstein. My pronouns are she, her, and I am an associate professor at the University of North Carolina and the director of the Re-Envisioning Health Justice Lab.
So thank you so much for being here. We would love if you could give our listeners an overview of the research you're conducting.
So I'm trained as a community psychologist, so tend to think about social problems as framed by the socially ecological model. So thinking about people nested in families, communities bounded by policy. And when I think about mass incarceration, that's the framework that I use, thinking about the criminal legal system as impacting people, families, communities. And it can look really different depending on the community that you might live in, depending on the policies in that place. So most of the research that I do in the lab is using that framework and thinking about mass incarceration as a structural determinant of health and an integral facet of structural racism that exacerbates racial inequities in this country. So we do all kinds of research, thinking about different health outcomes, ranging from mortality to HIV to substance use. We've done a lot of work in COVID-19 and really just thinking about how does incarceration or exposure to the criminal legal system impact people's health, people's family, people's community.
That 100% makes sense. And your educational journey is so interesting. How did you find yourself pursuing research around the health effects of incarceration?
Yeah, so I think I have a bit of a twisted journey. I'm a first generation college student. And so when I went to college, I didn't really know what I was doing or how to do it, but was interested in very complicated social problems. And so majored in criminology. And then I moved to New York City and I started a master's degree in criminal justice policy. And so I started to see the system and the system's impact and think on the systems level. And one of the things that I thought about was really, like how do you prove to people that the system itself has lingering or life course effects? And one of the easiest ways to do that is to think about health over the life course. So if you can convince people that there are these impacts that happen outside of the time that one might spend in prison or jail, and that might impact their families, that might be intergenerational, then you can start to actually think about movement relevant to policy change. So that's really like how I arrived at health.
That's amazing. You mentioned that you are the lab director for the UNC Re-Envisioning Health and Justice Lab. Can you tell us a little bit about the lab and what you guys do?
Yeah. So we use that framework that I just mentioned to apply to thinking about incarceration and how incarceration impacts people. We have postdoctoral fellows, we have lots of students, we have staff who are project directors on a number of grants that are funded by the National Institutes of Health or by private foundations. And what we're really trying to do is to uncover the impacts that incarceration might have and then think about how to make the system better. In the work that we do, we often find a tension between improving conditions of confinement and actually moving toward abolition of the system as it currently exists.
Yeah.
And, really thinking about how to do that. Like, how do we move to rethinking the paradigm that we have? And then also, how do we improve people's conditions right now? So a lot of the work we do is sometimes partnering with criminal justice agencies to improve the living conditions that people might live in, and then also thinking bigger about how do we reinvent the system itself.
Wow, just casual. Reinventing
Yeah,
the criminal
exactly.
justice system.
Right.
Yeah. Yeah, sometimes it's pretty depressing.
I can imagine it sounds like a complicated issue.
Yeah.
It certainly can be.
Yeah.
Yeah.
Is it centered your research around the US?
Yeah, so we do a lot of stuff in North Carolina. I did a postdoc at Brown, so also have roots in Rhode Island.
Mhm.
Um, and some of the stuff that we've been doing more recently is using big data or publicly available data from lots of different systems across the country. And so I feel like as the lab has developed, we've had this more national focus where we're trying to think about the system as a whole.
In the article that I read where you were quoted, it mentioned that at the moment, prisons in the US are at over 100% capacity. How do issues like overcrowding affect healthcare for incarcerated people?
Yeah, it's a perfect question. So, using the best data that we have, prisons are
Mhm.
at about 106% capacity, so overcrowded on average. And that's important for a number of reasons because when prisons are over capacity, you might see that access to services might be limited because there's not resources or staff available to provide things like healthcare.
Yeah.
There's a case out of California that you might be familiar with called Brown versus Plata, which really shows that when you have a prison system that's over capacity, it can impact the delivery of healthcare.
Mhm.
Yeah, and so in California, the prison system was ordered to release a certain amount of people
Yeah.
so that people would have that constitutionally mandated right to healthcare. But in the context of COVID, if we think about the impact of a particular health outcome, overcrowded prisons saw
Yeah.
some of the biggest single site cluster outbreaks in the country.
Right.
And that really is because lots of people in crowded spaces, very little ventilation or ability to engage in a lot of the practices like social distancing that we did in the community. And so it can have impacts for community spread and then also impacts in the larger community that a prison or jail might be in as well.
Yeah, that makes sense. Unfortunately.
Did you see any during COVID, any kind of shifts in like policy for prison systems when it came to COVID?
Jails, on average, at the beginning of the pandemic,
Mm.
reduced their population by about 30%, prisons by about 5%. But unfortunately, we've seen those numbers go right back up to normal and in more current times. So,
Mhm.
kind of a return to status quo relevant to the number of people incarcerated, unfortunately, very recently. But we did see some change, but it didn't last.
Yeah. And in your experience, is there a higher level or maybe the same level of sort of distrust in the healthcare system in incarcerated populations? And how does that affect, their health on average?
Yeah, absolutely. So it's well known that people who are incarcerated mistrust the systems that are entrusted to take care of them, right? So the prison system,
Yeah.
and that is because of deep legacies of unethical treatment. I think that in the context of COVID and even before COVID, there's been a lot of mistrust in the healthcare systems that also are mandated to treat people who are incarcerated. And so I think it leads to under screening for conditions, under treatment, and poor service delivery because there is this massive mistrust in both healthcare systems and carceral systems.
Hmm.
We saw that play out big time in COVID. People not wanting to get tested because if they were tested, then they would be put in isolation or quarantine.
Hmm.
Those conditions often mimicked conditions like solitary confinement.
Mm-hmm.
And so there's this punitive spin, right? So, like, sometimes gaining access to care or treatment
Yeah.
feels like a punishment. And I think that furthers the mistrust that this population has.
I didn't even think about that. Like being in isolation is, it's a form of punishment.
Yeah.
Yeah. In your article, Incarceration as a Catalyst for Worsening Health, you discussed the impact of incarceration physically and mentally for people who are incarcerated. When you started that research, were you hoping to discover anything? Did you think you would uncover kind of surprises along the way?
Yeah. So when I wrote that piece, it really was because there had been an emerging literature that really provided a lot of evidence that there was an association between incarceration and worsened health. But what really hadn't been done yet is thinking about what the mechanisms of incarceration are. So, what is it about the carceral experience that impacts people, families, communities negatively? And so, that framework in many ways set out a research agenda for me and my group to think about, what are the paths that we need to walk down relevant to uncovering how incarceration impacts health. And I think one of the things that I might, now 10 years, probably 10 years since I wrote that piece,
Mm.
might come as a surprise to old me is that so much of this is institutionalized and systematic.
Yeah.
There are all these structural factors that really date back to the beginning of our country, right? If we think about mass incarceration as an evolution from slavery to Jim Crow to our current paradigm,
Mm.
it's really so baked into the system. And so I think, one thing that I might categorize as not surprising, but certainly difficult is that a lot of this is really hard to change.
What surprised me the most when reading your work was how deep the issues here go, and like you said, they sort of in a lot of ways feel inevitable and unchangeable. Is there anything that for you makes you feel hopeful about the direction that things are moving or anything like that?
Yeah, I think there are a couple of things that make me feel like we can get to where we need to be as a society. One thing is in the context of the pandemic, we, for a long time, people that do this research, people who have lived through a carceral experience, advocates have known that there's a very strong connection between what happens in prisons and jails and the surrounding community.
Yeah.
But it's so clear to see it when you look at
Mm-hmm.
COVID-19 because you have staff who come to work in an environment that's very risky and they go back home and they might spread COVID to their community. So it's just very clear to see the connection between carceral spaces and community. And I think lots of people who'd never really thought about that before are definitely thinking about it now.
Yeah.
And so if I think about public health agencies that often think about jails and prisons as not in their purview, I think that is changed to some degree. They say, oh, what happens here is really important and we ought to think about it. And the people that live and work here come back home. They're a part of our community, they impact our community. And so I think one thing that keeps me hopeful is that a lot of people who didn't before do see the connection between jails and prisons and broader public health.
Right.
And then I will say that, when we think about the movement for decarceration or thinking about public health alternatives to incarceration, we see a lot of movement on that front across the different intercepts of the criminal legal system. We see
Hmm.
alternative first responder programs that send out social workers, peer support, rather than police in the context of mental health crisis or substance use or other kind of unmet needs. And I
Right.
think that's good, and that keeps people from ever entering the system itself, which is really good. And then I think we have seen those numbers of people who are incarcerated kind of pop back up to where they were, but I think that it is on the minds of
Hmm.
many more people who both administer criminal legal systems, who are public health actors, people in the community that you know they're thinking about like, should we have these spaces in our community?
Right.
So I think there are some spaces for hope, but I think in some ways that's tempered by the fact that a lot of these things take a long time to change. It's a real commitment.
Mm-hmm.
Yeah.
But in terms of things that we can improve on, if someone was like a concerned citizen, just like as a member of society, what are some things you would recommend on an individual level? And then in terms of policy change, what are some things that you would love to see move forward?
Yeah. So on a very individual level, I always want to ask people to ask themselves, do I really need to call 911 for that?
Mm-hmm.
And I think that's something that you can like bring to the Thanksgiving table, right? Like, do I need to call 911 if there's someone who is maybe having a mental health episode outside my window, but is not harming anyone? Or do I need to have resources
Mm-hmm.
like on tap to call my mental health agency that I'm aware of? So I think we need to, as Americans, ask ourselves, like, why are we calling police in the instance of an overdose?
Right.
Makes no sense. But I think a lot of people just take it for granted that like police are the people you call when X happens. So kind of having some critical engagement with that question of why, I think, is important.
Mm-hmm.
And I think the other thing is, unfortunately, because incarceration is so local, if you're interested in this topic, like really get to know like who's running for sheriff in your town can have a big impact on like what the criminal legal system looks like in your community, and make sure that you're voting in those really local elections and asking sheriff candidates really important questions. I think those are the two things that you can do as a concerned citizen in your own community. And then I think really just like digging into the history is the bigger part, right? Like the more macro part is really getting a sense of like how we got here.
Yeah. And I like the point that you brought up about why are you calling 911? Because I feel like
Love it.
that wasn't something that I had really considered until I read the story that I'm specifically thinking about was in, I think it was in Denver, Colorado. The man's name was Elijah McClain.
Yep.
And someone essentially called the police on him because he was listening to headphones and dancing down the street. And so I think if I could,
right,
that story specifically, if our listeners have not read that, please go read it. And I think it will make you think twice before you call 911 about a non-emergency issue.
Exactly. I totally agree. It can result in the loss of someone's life. Yeah,
Yep.
Absolutely.
Unfortunately.
And then why do you think, well, this might be, I don't know if you're comfortable answering this, but why do you feel, or do you feel like incarceration is like a politicized topic, or do you feel like there's like middle ground in some areas?
I mean, I think it's politicized. I think, I don't know how far deep I want to go into this, but, it's politicized in part because it's a tool of oppression,
Yeah.
So if we think about the carceral system, it takes away the right to vote for some people.
Yeah.
We've seen some campaigns that have restored rights, but it's actually still incredibly difficult to get those rights back, even in these states that have had some progress in that regard. But it's literally taking away people's ability to engage in to do civic engagement. And then if we think about other restrictions of rights that were part of the war on drugs in the 80s and 90s, people could didn't have access to certain types of housing or certain types of jobs or certain types of benefits, and so it creates chaos, such that people can't in many ways pay attention to the big picture, right? Because they've got to worry about where to sleep and where to work and how to provide for a family. And so it has this destabilizing effect. So you can't help but think, especially given the traditions of our system and the roots all the way back to the beginning of this country, that it's not intentional, right?
Yeah.
I mean, we haven't really talked about racial inequity much yet, but people of color are targeted by the system. They're incarcerated longer in the system.
Yeah. And people don't always want to, I feel like, address sort of the elephant in the room, but I also feel like it's impossible to talk about incarcerated populations without talking about the demographic skew.
Yeah, that's right. I mean, if you look at research on drug use, it's very clear and has been shown over and over again that white people and Black people use drugs at the same rate, or white people tend to use drugs more. It's really just about what are the communities that are over policed.
Right, 100%.
So you wrote in one of the articles about circumstances an individual comes in contact with during incarceration that contributes to worsening health. And you had 6 different ones. I think some of them are like, yeah, that makes total sense. Like coercive environment, prison conditions. Nobody is signing up to go. So like, obviously everyone knows that that's, at least they might not understand the depth, but they understand that it is not something they want to subject themselves or their loved ones to, right? There was a couple of them, and we talked about prison code already, but like deprivation and then the mandatory provision of healthcare, that I'd love for you to just spend some time sharing about both of those, if you could.
Yeah, of course. So the most extreme example of deprivation is solitary confinement, which I touched on a little bit before in the context of COVID-19. But our group has actually shown that any exposure to solitary confinement, 1 day, 1 hour, contributes to an increased risk of mortality in the first year post-release.
Yeah.
And so if we think about deprivation, it impacts mental health. We are social beings. We want to be in relation to each other. And in many ways, the carceral environment strips that from us. It's harder for us to keep in touch with our loved ones. It's harder to form relationships. with people you're incarcerated with, and the conditions themselves worsen all of that and worsen people's mental and physical health. When we think about the mandatory right to health care, the access may be there, but often the quality of that care is hard to determine, or it's worse than we might expect in the community. And so, can contribute to worsening of health problems, undiscovered health problems that are pre-existing, et cetera.
Yeah, one of these articles mentioned the fact that 40% of incarcerated people have chronic conditions, and a lot of them discover that they have a chronic condition because they were arrested and got health care for the first time
Yeah.
when they were in prison. And
Right.
you described that in the article as an indictment on the healthcare system, and I totally agree. That's horrifying.
Yeah.
But in terms of chronic conditions in such a stressful environment, it seems like
Hmm.
almost any chronic condition would be exacerbated.
Right.
Things like that are very difficult, I would imagine, to manage chronic conditions when you're in that type of environment.
Yep, absolutely. I mean, it's really because the incarceration experience is a form of trauma. And so you're right that on average, people who are incarcerated have at least one chronic condition. And sometimes the only care you've ever gotten in your entire life might be in the jail or prison that you find yourself in, which I think doesn't say much about the carceral system and access to care, the quality of care that you're going to get there. It really is an indictment of access to care in our communities.
So just to kind of take a step back and give the broad view, I guess as you're discussing this, I don't even really know what healthcare looks like in a prison. Can you give us just a
Yeah.
broad overview of what exactly that looks like? Are incarcerated people seeing doctors regularly or just when they have a problem, or how does that work?
Yeah, it's a great question. And it's actually a very difficult question to answer because the systems themselves are so different. If we think about
Mm-hmm.
50 states, Federal Bureau of Prisons, Immigration's Customs Enforcement, Puerto Rico, DC.
Mm.
And then we think about the jail systems. I live in North Carolina. There are, I think, 100 counties in the state, something like 99 or 98 jails, and they all they have their own autonomy. So
That feels wrong. I don't know.
I agree. No, and it makes it incredibly difficult to track
Yeah.
Mm-hmm.
and to keep systems accountable because they're all so different.
Right.
There are some, like standard models that are used, like you can have DOC or jail employ healthcare
Mm-hmm.
workers, and so they work for the jail or prison.
Mm.
You can have a private company who comes in and you contract with, and the healthcare workers work for that private entity. Or you can have like a public health department, which doesn't actually happen that much, but sometimes you might have a public health department and they are employing your healthcare workers. So it usually looks like that. And sometimes you might have an academic partner that comes in and gives specialty care.
Mm.
Okay.
And it totally depends on how well resourced you are. If you're going to see a provider often, if you're not, a rural jail or a rural prison might have like one doctor they contract with and you only see that doctor every month.
Mm.
They like only come around once a month. And if you're somewhere like Los Angeles or Rikers, you might actually have a full staff that is available a lot more.
Okay.
So it's very, very variable.
Yeah. And you brought up a word that I sort of think of as a buzzword when you talk about incarceration, which is privatization.
Mm.
Can you talk a little bit about your perspective on privatization and specifically the privatization of healthcare in an incarceration context seems like a huge conflict of interest to me.
I agree. I think in a perfect world we would not have privatization of prisons, jails, or healthcare, because you're right. There is a conflict of interest. If the motive is to make money, then you have to question whether the best, most comprehensive care is being given to people who are very marginalized, who have a lot of mistrust, who have a lot of medical needs that have been unmet.
Mm-hmm. The push to kind of bring all of these individual pieces under one kind of like governing umbrella to really track and hold accountable. Why is that not like the topic?
Yeah, to me, there should be legislation on the table that makes states have to be accountable to some type of standard.
Yeah.
Part of the problem is that Estelle versus Gamble, which gives the constitutional right to healthcare, says that carceral spaces have to meet the community standard of care. And if I was to ask 10 people from 10 different places what the community standard of care was, they'd have different answers. Like what healthcare access and the standard looks like in New York City is very different than it might look like in rural North Carolina. And so it's very difficult to judge whether, based on those standards, whether a prison or jail is meeting them. But if we were to introduce legislation that set those standards up very clearly, then we could do something that would have more impact, that would hold prisons and jails accountable.
Right.
But there's so much data innovation that has happened, and like data access and data tools, so there needs to be innovation relevant to data reporting in real time. And I'll say that, if you take COVID as an example, I swear to God, 53 prison systems basically launched data dashboards overnight.
Wow.
So they proved they could do it.
If they wanted to.
And a big light is being shined on them.
Yeah. I mean, you mentioned it's so hard because it's such a big population that it feels like when you're looking at statistics and things like that, it doesn't feel like as much of a human issue as when you think about the fact that each data point there is an individual human being. And I think people can really lose sight of that. And I was listening to the podcast Criminal did an episode where they interviewed a father who had a son that was incarcerated in like a youth corrections facility. And for 6 weeks, I think he couldn't find his son because they didn't have his name on record.
Mm.
And he was in a hospital after being, badly beaten in a fight. And the father, it took him 6 weeks to track down a human being, and anyway, the prison kept basically putting him off because they didn't want to talk about the issue. And I think that in a lot of these cases, it seems to come back to the fact that they are able to get away with kicking the can down the road because they don't want to talk about the issues that are going on inside. Does that reflect your experience?
It's fascinating because I feel like dehumanization is the word that comes to mind. Really not honoring the dignity of each individual human being. And in America, we've fooled ourselves into thinking that like we're all individually responsible for ourselves. And so if you commit a crime, air quotes for people that can't see me, then it's on you, right? And like it's your fault. But we ignore the marginalization, the intergenerational trauma, the history of this country, and we do that to protect ourselves from the hard truth that it really isn't about the individual. And it allows us to do atrocious things as a country that really are should be considered human rights violations.
Right.
I think so. In the lab, we started a project called the Third City Project, which is a new project trying to get publicly available data similar to the COVID Prison Project on two things: population, so number of people that are incarcerated in real time, and also mortality. And the name, the Third City Project, is social math, because we want to try to get through to people that these are human beings, right? So like if you think about the number of people who are incarcerated in this country, it's basically as big as the third largest city in America. And I think when you think about it that way, you can't ignore the scope. And it reminds people, well, these are people, these are human beings. Yeah.
They shouldn't be a protected group of people is what you can rationalize by saying, well, they did the crime, they should do the time, right? But what constitutes, doing the time for a crime, which, a significant portion of the time they didn't even actually commit?
Yeah, right.
I don't know what my question was, but it sucks.
Yeah. I mean, if we think about the jail population in particular, it's like mostly pre-trial detainees, meaning they have not yet been convicted of a crime. They're being held before that. And 11 million people in this country cycle through a jail in any given year. And so massive numbers of people being exposed to these settings who, didn't commit a crime.
Right. Legally are innocent.
Yeah. It's like you can't really even hone down. Like I heard about, I don't know what state it was, some embarrassing state that had like outdoor prisons where they had people like living in tents, right?
Right.
And that was like applauded by some people. I'm like, that's disgusting. Like, that's not right.
Yeah.
Mm-mm.
And in terms of post-release issues, you talked about the idea in one publication about invisible punishments. Could you talk a little bit more about those and about why it's so hard for people to transition out of incarceration?
Yeah, I think a lot of people are under the false assumption that, once you've done your time, the impacts of that incarceration are over. But that is not how it works for most people. Reintegration in the community takes a lot of work and a lot of resources that people often don't have access to. You may want a job that requires a criminal background, so you're barred from those kind of jobs. You may not have access to certain types of housing. There are certain, especially if you're on probation or parole, certain restrictions about living with other people who have criminal records. And so, if you've got a mom or a brother or a sister or dad who's also been involved in the criminal legal system, that access to that housing to staying with that family is no longer available to you. And we also see this thing that many people refer to as carceral creep, which really means like lots of community organizations and other governmental agencies take on this punitiveness, especially when it comes to people who have been involved in the criminal legal system, right? So if your healthcare provider knows that you've been in prison, and they have, they might have adopted some kind of like non-compliance, missing one appointment, no longer to be seen at this clinic type stance, then you might be impacted negatively if it's hard for you to make a doctor's appointment because you are trying to find housing or you're trying to get a job, etc.
Yeah.
And so, I used the phrase before, chaos. I think the system itself creates a lot of chaos in people's lives and strips people of the ability to have resources to overcome that chaos.
I mean, is it possible for someone to really, quote unquote, reintegrate back into society with those barriers?
Yeah, I think so. I mean, I think it's incredibly difficult. I'm like a big believer in therapy. So like
Same.
people have
Yeah.
access to good therapy and to good people in their lives and, non-stigmatizing communities. And
Right.
I think so, but I think it's incredibly hard to do. And we often blame people individually when they don't figure it out.
Yeah.
You would think like therapy would be part of
Yeah.
reintegration. That would be the first thing.
Absolutely.
And then it feels like, of course, right, this is like a spiral where if you have access to things like therapy, you're less likely to like find yourself trapped in that system again. And if you don't.
Yeah. Or a support system.
Exactly. So you have like access or no access, which means like money, no money, really, at the end of the day. And then it's just back in.
Yeah, absolutely.
Number one, thank you so much for being here with us and discussing this issue, because I feel like the incarcerated population can be invisible if you're not directly thinking about it. And so we're so appreciative of the work that you do and
Right, 100%.
and just getting this information out there, I feel like is so important. And then on a lighter note, we always ask all of our guests, we close out the interview with, how do you take your coffee?
I love that. So thank you so much for having me. It's been really fun. And how do I take my coffee? I only drink decaf now because I'm super lame. So a decaf with oat milk and 2 stevia. So I'm like a stereotype.
Love that. Cool. Thank you so much, Lauren. You are fantastic. You're doing great work, and we are super excited to talk to you.
Yeah, that was great. Thank you.
Thanks. Hey, Mal Pals. Thanks for listening. The sources and links for this episode can be found in our show notes. If you haven't already, go follow us on social media. You can find us on Instagram, Facebook, and Twitter at Malpractice Podcast. You can also send topic suggestions, questions, or concerns to our email, malpracticepodcast@gmail.com. And just as a reminder, if you like what you're hearing, you should definitely subscribe, rate, and review us on Apple Podcasts, Spotify, Stitcher, or wherever you like to listen. And don't forget, malpractice makes perfect.